happy Tuesday. I'm Dr. Mark Heisig. It is 9 a.m. I'm going to try to turn these into like the Tuesday 10, try to keep them 10 minutes or less, because I feel like I ramble. I feel like things get lost, and it would be more useful to have like bite-sized chunks of this information. Just brief concussion tidbits you can chew on with your concussion doc. Good morning, good morning, good morning. You're a concussion provider or your friends, your family. You can be the coolest person at the party because, of course, everyone wants to talk about concussions. So today we're going to talk about biological males, biological females, and concussions. And so we tend to see differences across these sexes. Across gender-matched sports, we tend to see that women suffer more concussions than men. And we tend to see that among those who suffer concussion, women tend to progress to PCS or persistent concussion symptoms, often called post-concussion syndrome, but women tend to progress to PCS more often than men. And so like, what gives? We're going to talk about it. Much of these notes, I will say, come from information and research presented. I pulled from different areas, but most of it comes from research presented from the CCMI training. So shout out to Dr. Marshall and his crew for geeking out on the cervical spine and some of the stuff that we're going to talk about. But so some example concussion stats, because if you can't picture what this looks like, last week I was talking about ice hockey. We kind of talked about, I talked about my experiences in hockey, what to look for in a concussion on the ice and what management would look like. And I also talked about some of the stats in hockey. And when we look at women's versus men's ice hockey, we see that when we're presenting concussion stats, we talk about per 1,000 athlete exposures. So in men's ice hockey, per 1,000 athletes kind of exposed to the game, we see about 1.62 concussions. So 1.62 concussions per 1,000 athlete exposure in men's ice hockey. In women's ice hockey, we see about 2.27 per 1,000 athlete exposures. So 1.62 in men, 2.27 in women. That's a higher difference. That's actually a 40% difference. So relatively speaking, women in ice hockey, we tend to see about 40% more concussions. And so what gives? So we're going to talk about 4 different reasons that are kind of big. A 5th one that maybe, but yeah, so let's jump in. So there's the ideas around possibly neck strength and endurance, hormonal differences, the honesty hypothesis, which is kind of funny and sad for us guys. And then Dr. Marshall, Cameron Marshall, CCMI concussion doc, has a theory of game awareness that I think is really interesting and we should possibly explore a little bit. So let's start off with neck strength and endurance differences, because a lot of people think that neck strength, there's this one study that's always cited that like for every pound of neck strength increase we have, there's a percentage concussion decrease. And I'm sure to some degree that's true, but to another degree, it's less about the strength. This could be a whole nother video. It's less about the strength and more about how quickly and how properly timed that strength and stiffness is. It doesn't matter how strong your neck is if you don't have the muscles contracted at the right time, right? So strength matters, but it doesn't. So when we're looking at men versus women, we actually attach different things to their head and kind of yank their head around. We let them know it's coming, and we do and we don't let them know it's coming. There's different reaction parameters that we look at. But when we do that to men versus women, women tend to show more neuromuscular recruitment than men. So what that means is women tend to recruit a lot more muscle fibers, a lot more different muscle groups to stabilize their head. So women show more neuromuscular recruitment than men. Men tend to rely just more on brute strength. So we might recruit less areas, less muscle fibers, but we have got that stronger fibers right there. So men rely more on strength than women. Women rely more on neuromuscular recruitment than men. And what this may play out as is women recruit more vast areas of muscles, and this may fatigue women faster because you're requiring more metabolically active tissue during sport or during whatever you're doing. So you're recruiting, while men, I'm not pulling specific muscles here, but while men may recruit and just require strength out of one area, women are recruiting vast areas. That's what we tend to see in the studies. And those more widespread areas may be requiring more metabolically demanding substrate. We might just be burning more fuel, more energy doing that. And that fatigue may play into what we see in concussion later. So it may not be a strength issue. It may not be an endurance or reactivity issue. It may be an endurance issue. that we tend to see women having more concussion just by virtue of how they recruit muscles. The other big glaring obvious difference is that men and women have different hormones circulating through their body, not different hormones, but different levels of hormones. And then at various times, like pregnancy, just overtly different hormones. But so we tend to see that, sorry, I lost my train of thought, hormone differences. Women tend to have more, just more of a protective calming neurosteroid known as progesterone. Than men, especially during the luteal phase after ovulation. You'll see progesterone and estrogen spike in women, not spike, but rise. And so progesterone's, it's actually studied when we pair it with vitamin D as an acute concussion treatment. Progesterone is a protective, calming, anti-inflammatory neurosteroid. And when we give it with vitamin D, that's actually the only time that vitamin D is considered effective as an acute treatment for concussion. So if progesterone is protective, why does that seem to be a factor in women sustaining more concussion or having more persistent concussion symptoms? The concussive head impact may cause a jarring drop in progesterone, which may lead to worse outcomes. And so while that's kind of confusing, I shrug. I don't know. That's just one of the things that the research is throwing out, is that these hormone differences, it may be this drop in progesterone that women have that leads to worse outcomes, whereas men were already cruising at low progesterone, so maybe it doesn't affect us as much. I'm not sure how to reconcile that, but that's what we're talking about. The third one that we talk about is the honesty hypothesis. So we talked about neck strength and endurance. Women recruit more neuromuscular recruitment. Maybe they fatigue faster. Maybe there's less reactivity and less strength later in the game. And so there's more susceptibility, more risk for concussion. The hormone differences possibly at a significant enough head impact for concussion. Women may see this tank in progesterone, this protective neurosteroid. And the honesty hypothesis. Women may just be more likely to report symptoms and their status honestly compared to men. And so toxic masculinity, especially within sports, says that injury is weakness. And I'm not saying that women don't experience this. I'm not saying that women aren't pressured to hide an injury or aren't pressured to be tough and to tough it out through their sport. But we tend to see the toxic masculinity of men being like, I can't have feelings. I can't feel pain. I can only express anger and brute force. So it's better not to be weak and to just man up and not report your symptoms. Not a great idea, fellas. And this may be one of the discrepancies that we see between male and female concussion numbers, is that women might just be reporting their symptoms honestly. What about for children? As far as I know, yes. These numbers are just looking at, when you look at children have different risk regardless, just because of head size. So kids are just kind of bobbleheads. Their body doesn't catch up to their head size. Your head is about 90% of as big as it's going to be as an adult. Your head's about 90% that size by the time you're 4 years old. So you're carrying that around. You don't have the developed like cervical musculature. You don't have the developed neuromuscular coordination yet. So my guess is that all these factors maybe play a role, maybe not the progesterone as much. We're not going to get into that. But yeah, so neck strength, endurance differences, hormonal differences, honesty hypothesis. And then Dr. Cameron Marshall has a cool theory of game awareness. And this calls upon the rule differences between sports. So it's not saying that women aren't aware of the game that they're playing. Absolutely. Beast female athletes out there. One of the things that this is talking about is game awareness in terms of the rules of the sport. Male sports have body contacts just engineered into the rules. I remember when I was switching, I believe when I was a kid, it was from squirt to peewee. So I think once I turned 10, I was allowed to hit. I don't think you're allowed to do that anymore. But so it was just this ingrained piece of our sport. Like as soon as I jumped that age division, I knew that the second I touched the puck on the ice, there was a chance of someone just trying to train wreck me, especially early on when hitting was exciting and hormones are pumping and all these little boys. You're trying to hit, you're trying to prove how strong you are. And as a guy, as a male athlete, you know that that's just a possibility. Not all female sports have the same body contact rules. So while men are always expecting to get hit, women may not always be expecting to get hit. And so it's not that the hits are intentional, but it's when that unintentional hit happens, there's not that same reactivity. There's not that same mental, just like, I've got to be ready to be clobbered. So we may not see women having that same preparatory neck stiffness when it comes to gameplay. Hasn't been totally tested out, just a theory from Dr. Cameron Marshall. But I thought it was really interesting because it's a fun thought to have of like, oh yeah, like if I wasn't expecting to get hit in hockey, I definitely would just be a little more loose. I know when I play roller hockey, I'm a lot less, I look down at the ice more. I try to get a little bit fancier with the puck, just because I know there's no overt body contact, like open ice hits or open rink hits in roller hockey. So I know game awareness impacts how I play my game, and I'm sure that it impacts other people as well. So that's a fun theory. So neck strength and endurance differences, really just muscle recruitment differences, hormone differences, the honesty hypothesis, and then possibly game awareness. And then some research even shows that this is kind of newer, but there was some research looking at kind of the actual neurons of men versus women. There may be different protein filament integrity and density and blah, blah, blah. That may be hormonal and how those proteins are regulated. Definitely more research needed there, so I'm not even going to talk about it. I want to look at one last question here. What about female athletes like figure skaters who are expecting to fall and that kind of intense body contact? Yeah, so you're as susceptible as any other athlete. If you're expecting the fall and you're bracing and yada, 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 all those same cervical neck mechanisms, like you're going to be as prepared. And if you're going to get concussed, you're going to get concussed. Where the differences between men and women, right, might be there. Like if you're a figure skater, it would be what we see in terms of the hormonal differences, in terms of female, the honesty hypothesis, your willingness or a female's willingness to report symptoms versus a male's, and then possibly even the protein density of the neurons. So that wasn't 10 minutes, was about 15 minutes. Thank you for everyone who joined. I'm going to post this later. If you have any questions, leave it in the comments. You can find it in my Instagram TV. So thank you.